We're good. Okay. Thank you so much for coming out today, first of all, in the winter, and second of all, to talk about a pretty embarrassing topic. But fortunately, physical therapists love talking about all parts of the human body. So I am open to whatever questions you have for me. Um, we're going to dive into some sensitive territory, but you're in good hands. All right, today we are going to cover pelvic floor anatomy. So we'll keep it pretty PG rated, but it's important to understand and get the sense of the body parts we're going to be talking about. It's hard to really grasp what to do when things go wrong if you sort of don't have a handle on the anatomy. So we'll cover the anatomy. We'll also talk about what incontinence is. From my experience with pelvic floor therapy, a lot of people make excuses for, various forms of incontinence as, oh, that's just kind of normal. So we'll break down what's normal and what's not normal, and then dive into different types of incontinence. There are multiple types. You can have different things causing the same symptoms. So we'll kind of break down what those different types of incontinence are. Then, probably the most important part, we'll dive into what you can do about it. I'm going to give you a breakdown from the physical therapy perspective and what happens when somebody comes to see myself or one of our other therapists for physical therapy, specifically for incontinence. And then I'm going to give you some self-management techniques. So some stuff you can take home and practice right away after leaving this room. Okay. I'm pretty open to questions. So, I'll take question breaks after each section. But, if you have a burning question that must be answered, just wave your hand. All right. Pelvic floor anatomy. I will tell you when to cover your eyes. No, it's not that bad. All right, we're going to start with the bones. Okay, so bones and joints that make up the pelvis. You have two ilium. Oops. There. So the ilium, that's these two bones here on the sides. So if you were to feel these bones right here, that's the top of those hip bones. And then underneath where it says ischium, I don't know if you can see that, that's these ones back here, the ones you sit on. So those kind of make up the two halves of the pelvis. Those two halves of the pelvis meet in the front. That's called the pubic symphysis. And they meet in the back, and that's called the sacrum. It's a V-shaped bone at the bottom of your spine. So they're two separate bones that have a connection in the front and a connection in the back. Those don't move a ton. There's a little shearing and a little sliding and a little gliding that has to happen. Babies could not be born if there wasn't a little bit of movement in those, if those iliums couldn't move, but they're not supposed to move a ton. It's not uncommon for back pain to be caused by one of those joints being out of alignment from too much movement, but those are supposed to be relatively still. And then the other part of the bony anatomy is the hip joint. So your femur, these bones right here, the long leg bones, come up and meet each ilium, and that forms your hips. All right, so there's a lot of joints involved in the pelvic floor. This structure forms the bottom of a cylinder. So if you can kind of imagine the two ilium, you have your legs coming down, your spine coming up. Those two ilium form sort of a bowl, like the bottom of a canister. And the pelvic floor muscles, which we're going to talk about next, fill in the bottom of that bowl. So let's talk about the muscles. It's a little more interesting here. So this is the top of this picture is the back. That's where your spine is. This is looking down into the bowl, okay? And then the front is that pubic symphysis that I talked about. So you have the sacrum and spine at the top of this picture. Front is at the bottom. We are looking down into that bowl. The pelvic floor consists of 3 layers of muscles that form that sling. Those layers of muscles are responsible for controlling all of the sphincters in that area. So around the urethra where pee comes out, around the vagina, the rectum, that controls all of those openings. That's what keeps them closed when they're supposed to be closed and lets them open when they're supposed to be open. So now you can kind of start to see where having good control and strength in those muscles is pretty vital to continence and not leaking. They should stay closed when you want them to stay closed. Also, over on the sides, you have 2 hip muscles that make up sort of the side walls, the piriformis, and it's called the obturator internus. Those 2 hip muscles are where the sciatic nerve runs through. So I don't know how many of you have experienced sciatic pain. It's not uncommon at all. That pain can cause dysfunction in those muscles, which can cause dysfunction in the pelvic floor. So a lot of these, more common back and hip injuries are things we have to screen for and fix to really get to the root of some pelvic floor problems too. It's all related. Everything's connected. The other really important thing about the pelvic floor and how it works is the canister. So I talked about the pelvic floor being the bottom of that canister. It fills in the bowl and forms the bottom of the sling. They don't work in isolation. You have the muscles at the top of that canister underneath your rib cage called the diaphragm. That makes the top and the bottom. So you have the diaphragm up here. That's not on this picture. I will show you a better picture of that. Diaphragm at the top, pelvic floor sling at the bottom. That's the top and the bottom of the canister. Those are supposed to work together. You have the front of the canister being the abdominal muscles. The rectus muscles are those 6-pack muscles that are on the front, and then you have some deeper muscles called transverse abdominals that are underneath that layer. And then the back side of the canister would be all the muscles in the spine. So we have diaphragm at the top, pelvic floor at the bottom, abs in the front, spine in the back. And they have to work together. They have to be coordinated for normal pelvic floor function to happen. And we will definitely be talking a lot about what happens when they're not coordinated. All right, now we're going a layer deeper. Organs. The pelvic floor muscles and the coordination and these muscles working correctly are vital for breathing, peeing, pooping, and sexual function. So they're kind of important. They have many roles in keeping our body healthy and providing normal function. It's critical that all parts of that canister are working in sync and are coordinated. So if one part is tight or one part is weak, if the pelvic floor is tight and the abdominals are weak or out of sync, that can throw off the whole system. Any questions so far? I also want to point out on this picture, and I can come over there real quick and point it out for you guys, but all of the organs, this happens to be a female anatomy, but it's not, minus some large differences. The bladder is up front here. The rectum is back here. If that is often full, if constipation is a chronic issue, and I won't ask you to raise your hands, but I'm guessing that there's a few people in the room that deal with constipation. The pressure from that can cause all kinds of urinary incontinence issues on its own. So sometimes the answer is just working on the constipation. And I'm going to step out of camera real quick just to point out this is what I was talking about. Rectum is back here, bladder is up here. Too much pressure back here puts force on that bladder. All right. So I just talked a lot about all those muscles working together, and I hope this works. I want to try a quick little video so you can see it in action. But before we do that, the picture on the left is an inhalation. So that's what happens when you take a deep breath in. See that purple arrow at the top is showing the diaphragm flatten out. So you take a deep breath in, your diaphragm goes from this position to this position. It creates a negative pressure that pulls air into your lungs. But as it presses down, it creates a lot of pressure in the intra-abdominal cavity. So inside that canister we just talked about. If the pelvic floor doesn't relax in unison with you taking a deep breath in, all that pressure builds up in the intra-abdominal cavity and you get pressure on your bladder and leaks can happen. That's one of the biggest causes of incontinence is this mismatch. We're breathing wrong. That is incredibly common. And then same thing when you exhale, when that diaphragm comes back up, naturally the pelvic floor should rise back up into position as well. So we use the breath to strengthen quite a bit because they naturally work together. They relax in unison and then they tighten together. So I'm going to try, I don't know if you guys see that green link. Are you able to click on that?
Did you hook up to the internet?
Kevin, I don't know.
The Wi-Fi here?
No. We'll try real quick. It's a 4-second video. Do you know what the password is, Kevin? Highly secure. Books 1, 2, 3. That's how I like my passwords. All right. It'll play on a loop. Okay. All right. So watch and, oh, it didn't, it's on my computer. I'll email it to you. How about that? I don't know, it's playing up here. How'd you get that to work?
Because I'm smarter.
Oh. All right, so what you're seeing here, look at the very bottom. Play it one more time. Ooh, that's pretty. All right, forget it. Forget it. I'll send it to you. But what it shows is just those moving in unison. That's all right, Kevin. It's okay. So you have the diaphragm flattening at the same time the pelvic floor is relaxing. I thought it'd be cool to show you a video, but I'll do this with my hands instead. Diaphragm flattens. Pressure would build up in that intra-abdominal cavity, but the pelvic floor relaxes and everything stays happy. Yes, exactly. We're going to practice that later too. How do you know if you have a tight pelvic floor? Most of us don't. It's not something you can tell. How do you know if you have a pelvic floor that doesn't relax when you breathe in? We have a lot of ways to help work on that, but I kind of equate it to if you pay attention to the muscles up here in your neck, that's a spot that a lot of people carry tension. You can walk around for hours or sit at your desk for hours and not realize that you're holding tension up there until someone points it out and you become aware, oh yeah, I do need to relax those muscles. So you can have tension and tight muscles in your body without being super aware of it. And sometimes just bringing awareness to the area will let you relax. So that's one of the tricks we use, just being aware of where those muscles are. Muscles might also be rigid with people with Parkinson's. So rigidity in muscles is one of the hallmark symptoms of Parkinson's. That is not just arm and leg muscles, that can be pelvic floor muscles too. So all of those muscles in that sling that I showed you, or in your abdominals, or in your low back, or in your hips might be less flexible and more rigid than they were prior to Parkinson's. And that can lead to this extra tension in the pelvic floor. So when that diaphragm pushes down, those muscles are too rigid to release. You can also have dystonia and tightness in the diaphragm. That is not an uncommon symptom that we see in people with Parkinson's. So you can't get that full extension and expansion of the diaphragm either. The other thing that can happen, things might not be as automatic as they used to. So Parkinson's sometimes robs people of some of the automaticity of those natural coordinated movements. Walking is a common one that we work on a lot, but this coordination between the diaphragm and the pelvic floor and the abdominals can also get a little funky too. Let's talk about what incontinence is. I promised you at the beginning that we'd talk a little bit about what's normal and what's not normal. And I will tell you right off the bat that if you are running to the bathroom, the first urge you feel, if there's any urinary leakage at all, if you have to put a pad in your underwear, none of that is normal. It is very common, but none of it is, none of it should be just kind of dismissed as, well, this happens. Yeah. That's something that we can address and work on. You have to be willing to talk about it though. So there's urinary incontinence. That's bladder leaks. It can be really teeny tiny small leaks. It can be a sudden gushing. You get a super strong urge where you, as soon as you stand up or as soon as you put the key in the door when you get home, you can get running to the bathroom is not a normal thing. Fecal incontinence can be little small leaks. It can be a complete loss of control. Having to wipe, I get a little gross, having to wipe over and over and over and never being able to fully clean is also a sign that the rectum is not holding like it should. Those muscles around that sphincter are not closing when they're supposed to be closed. So that, again, that alone can be a sign of incontinence. I mentioned again that incontinence is common but not normal. It is not just a consequence of aging. We'll talk a little bit a few slides from now in why this happens to our bodies, but it's not a normal consequence. And it affects 1 in 3 women and 1 in 9 men. So pretty common. Any idea why it affects women more often? Kids, that's right. Yeah, if we go back to that, we won't, but if we go back to that diagram with all the organs, in between the bladder and the colon, it was the uterus. So as the baby grows in there, there's all kinds of pressure on those surrounding organs and the muscles that have to hold the baby in there. And then the baby is delivered, and that wreaks havoc on muscles. So that is why it is more common in women. I personally think if we sent women to physical therapy after delivery, even if they felt good, that would probably cut down on that number, but we don't do that. Yeah. Yes, definitely. I won't ask any follow-up questions. Causes and risk factors. Why does this happen? So muscle damage, I just mentioned muscle damage from childbirth. That includes C-sections because you're cutting through those abdominal muscles, which are part of that canister. Any surgeries in the abdomen on any other abdominal organs can be a cause of this. And radiation from cancer treatments, especially the prostate, is another common area where muscle damage can happen. So if you've had any of those events, then you are predisposed to some of these incontinence issues. Hormonal changes, pregnancy or menopause are the big ones. They can change the flexibility in muscles and other tissues. Aging and weakness. So weakness does not have to be a normal part of aging. Older adults tend to slow down from other injuries. And then as normal activity decreases, pelvic floor strength will decrease as well. And if you're working out in the gym and trying to get stronger, you should be trying to strengthen the pelvic floor muscles too. Poor breathing coordination. We're going to do a test in a few minutes, but if you never really expand your diaphragm and just breathe up here at the upper part of the chest, those kind of habits can cause this. Mechanical pressure on some of the organs. So constipation, we touched on that briefly before, but constantly having that mechanical pressure from the colon forward on the bladder can irritate the bladder and cause urinary incontinence. An enlarged prostate muscle can push on the bladder and cause incontinence as well. Lifestyle factors, obesity, smoking, and this is a big one, holding it. So if you're someone who has just trained your bladder, this is common with physical therapists because we're running from one patient to the next, but resisting the urge to go and trying to hold it will disrupt the whole bladder neuro loop and can cause some incontinence. Muscle rigidity, slowed neural connections, some of those less automatic movements, those are all Parkinson's factors as well. Kevin, yeah, we can stop now. Let me do one more slide. Then there's a more natural stopping point. Kevin's got to go. All right. Give me a minute. Why do we care about this? Why is there a whole sector of physical therapy focused on the pelvic floor? Because this has a major quality of life impact. I put 1 star up here. 1 out of 5 stars, no one recommends incontinence. It can cause embarrassment, anxiety, maybe that leads to leaving the house less often and isolation. Concerns over sexual relationships with your partner. More common or predisposed to infections or just physical discomfort in the skin. Financial cost of incontinence pads and other supplies. And this is a big one, disrupted sleep. If you're having to get up many times during the night, you are not going to feel as rested. So common does not mean normal. People don't just accept it because it's kind of an embarrassing, uncomfortable topic to talk about. I assure you, your doctor, I can speak for healthcare workers in general, we are fascinated by the human body, every single part of it, every single function it does. So we are not embarrassed to talk about it. So don't accept this as normal if this is plaguing you. It's time to talk to a healthcare worker. And this is when I had planned the break. Perfect. So we'll take a little break. And then we'll talk about different types of incontinence and what you can do about it.
All right, take the next 10-15 minutes, stretch your legs, use the facilities, and let's reconvene at 10 minutes to 12.
Does Sydney and Tara